And welcome to this uncut teaching version of a soft nucleus cataract surgery. Every step will be shown to get a good idea of the flow and timing. There's the groove and the paracentesis. When I'm sitting temporal like this, I will always try to make the paracentesis inferior. That way I can burp viscoelastic the next day if it's needed. And I do switch hands between right and left depending on which eye. So you can see that posterior polar plaque there. At the beginning of the case, I wasn't sure where it was, but we'll get there. So here's our entry 2.7 millimeter diamond blade, little dimpling in to give it a biplanar appearance. Try for that relatively square tunnel, self-sealing. Had a little bit of trouble with patient anxiety and several episodes of quick movement like that. So here I go in with the cystotome forceps. These are a Barrett version. You can see the little notches at the 2.5 and 5 millimeter length. And there we go. The eye is off and running. We had to get a little extra help from anesthesia and kind of talk the patient down from this. But I was really pretty nervous about this rhexis. One bad movement at the wrong time can really make for a challenging case. So I was kind of going slow and being extremely ready for a sudden eye movement as best I could. And there we go, once again. So just had to kind of stop and recenter everything and kind of talk the patient down, add a little extra IV sedation. So just going to really work hard to get this rhexis nice and round and centered and right about 5.5 millimeters. So just got to take the time here. This is such a critical step in all cataract surgery. So going slow and just trying to be ready for that sudden movement. So there it is. We got the rhexis down. I can take a nice deep breath. This is a Chang hydrodissection cannula. I originally wasn't gelling with this cannula and saw it on a whole bunch of videos, so I thought I'd give it another try, and now I think I got it, and I do find it really useful. Gets in there and does a very reasonable job, and then with that angled bend, you can grab the nucleus and give it a good rotation to make sure everything's free. So I've been switching over to it lately. Here I'm trying to kind of flesh out that central hard nucleus. This is a very soft cataract, I know it is, but I just can't tell exactly how it's going to behave until I get in there. So here you're going to see me do a partial chop or a little attempt at a chop just to kind of judge the density. I'm really not trying to do very much other than to see, can I get any kind of purchase, can I get any kind of movement? And the answer is not very much, so that's okay. I'm going to switch over to the kind of a nibble technique where I'm just debulking as I go around, try to get a little bit of movement. And what I'm really looking for is that central core. And I think we'll see it in just a little minute here. There we go. There it comes. So I want to thank Dr. Uday Devgan over at UCLA from his one of his cataractcoach.com videos that showed that technique of releasing that central core. And now I just have a soft shell, so I'm just going to kind of nibble and rotate and try to get it to the point where I can flip it. So I just keep on moving it around and debulking, just being really careful, and there it is. That's the flip maneuver I was trying to get to. And once you get to that maneuver, then it's pretty straightforward. From there you can just kind of take the thing out, stay right in the center, let all the soft material come right to the tip. So that's what I'm going to do here and get the rest of this thing out. Now normally I would do a handoff maneuver where I'd put some viscoelastic in before I remove the phaco tip, but in this case I could sense things were getting a little anxious, and there we go. The eye's moving again, so I just really never had a chance to do that. Fortunately, I didn't get too much collapse. Did a little reposition of the head because because things were kind of tilting away from me. And now we're just going to do some standard IA cleanup of the soft stuff, and I really want to see what's going to happen to that central plaque. There's all our stats if anybody's interested. And fortunately, the central plaque cleaned up just great. There wasn't an issue there. Sometimes there can be a problem with that plaque, can be really, really stuck. But in this case, it wasn't. It just happened to be in the center, and that's why the vision was down. So I'm going to do a full cleanup, get everything ready to go. And then I do like to polish. I am a big believer in capsule polishing. I think it helps with the final lens position. I think it helps decrease the opacification down the road, and perhaps delays or lessens the need for YAG. So I go in and just give it a little polish. In this case, it was not a super thorough polish because, again, I was really worried about sudden eye movement. That's the last thing I wanted, was to take a good case and get the capsule hooked on the polisher with a sudden eye movement. So I just kind of went in, held my breath, and got out as fast as I could. So then we're going to inject our lens, pretty standard stuff. And the only thing I might do that maybe is a little bit different is I don't use an instrument to implant the lens. I use the IA. So I put it in like this, and then I get the IA in and pressurize the interchamber, rotate that tip down, and the lens just pops right into the bag. So it kind of saves a step and is very controlled. I do this for pretty much all the cases, even the small pupils. It goes in really well. And then I've got the IA in there, so now I can go to the next step, taking out the viscoelastic. And that's the whole case. So it's pretty straightforward, regular cataract, except a couple nuances because of the very soft nucleus. Alrighty, thank you very much.